If you've been diagnosed with a herniated disc and you're hoping it will heal on its own, then this video might save you weeks, months, maybe even years of pain. Today, we're going to go through when does a herniated disc actually need to be treated and when will it heal on its own. This video is for people who have been diagnosed with a herniated disc, a bulging disc, a disc extrusion. They're having sciatica, symptoms that are causing them pain day in and day out. So the answer is, will it heal on its own? Sometimes yes, and sometimes no. It's going to vary from case by case. However, there are some central components that are very common. So let's go through first, when will it potentially heal on its own? Well, if a disc is bulging, and this is the little disc here, and it's fairly small to moderate and not a huge, large size disc, in some cases that will just start to heal on its own. If the pain is more what we call central and not shooting down the leg necessarily, there's a good chance that it possibly will heal on its own. If, however, it is down the leg, but it starts to centralize, what we call it, meaning that the leg pain starts to come back and creep up, and we actually start having more of a noticeable lower back pain, then that's a good sign that it may heal on its own as well. If there's no significant nerve compression where we're having major weakness, horrible tingling, horrible nerve pain, this type of thing, then sometimes those discs are going to heal on their own. When they're not going to heal on their own, it's usually a very large disc. The pain is extreme. It's actually getting worse. Maybe we're having motor weakness, meaning the muscles aren't quite operating very well. We're not able to get out of bed very easily or move very well. And the overall symptoms are getting worse and worse. Typically at that stage, usually a patient's going to need to undergo some kind of a therapy. Now, a couple of things that may typically make it worse, okay? If we're aggressively stretching these type of situations, that can actually increase the compressive forces and make it worse. So if we do need treatment, or what you can do on your own, is a couple of very, very important concepts. So number one, we need to modify activities. For example, if we're in the gym, we're doing back squats or heavy deadlifts, that's going to dramatically increase compressive forces within that spine, and that's going to make it extremely challenging, if not impossible, for the disc to heal. So the first thing we have to do is try to figure out how to unload our spine. So don't cause external compressive forces. Generally, sitting is going to increase the compression, so try to limit that. Gentle, easy walks can help with that, okay? We also want to make sure we're staying very hydrated. If we're dehydrated, that's going to cause a little bit more tendency for compressive forces and start to make that a little bit worse. If we're really compressed, then you may need some external treatment that doesn't involve surgery, if that's the case. And what we do here is do exactly that. In some cases, you are going to need an injection. In some cases, you are going to need surgery. Non-surgical spinal decompression, it's not for everybody. Not everyone's candidates. It is a case-by-case scenario. So this is what we do in the office here. My name is Dr. Cassidy Boelk. I am a certified spinal decompression doctor and a doctor of chiropractic. And for the last 21 years, we've been focusing and helping people get out of pain without injections and surgery when it's appropriate and when they're candidates, utilizing non-surgical spinal decompression, which is very specific and very focused to their case and individualized. Not everyone gets the same treatments, and this non-surgical spinal decompression is fantastic. Don't get me wrong, but it's passive, right? You land a piece of equipment. If we don't involve you in the process and give you an active role and make it sure what you're doing outside of here is going to benefit you, we're going to have a limited response as well. So we want long-term relief with this. So if you're suffering from this type of situation, you've tried some of these things and you need some help, or you have a friend or family member that needs some answers, go ahead and give our office a call, 619-298-0800. And we can do a no-charge consultation, see if this is an option for you, and then we can take it one step at a time.